Hello and Assalamu alaikum, peace be with you. I'm just doing this short video just to answer some of the questions that people often have regarding our training and our courses. We often get phone calls and we get inquiries from people who have some interest in coupling therapy or hijama, and they want to find out more about our organisation and the training that we do. So I thought I would just clear up a few misconceptions and answer a few questions by covering some of those. So the first one is what makes us different from other providers. So what I would say is that in general, the providers that, the teachers who are involved in what we do all come from kind of an academic background or a formal background of education and training. I myself am a qualified chiropractic doctor, and I've worked in teaching chiropractors and teaching techniques on a kind of postgraduate level. So I'm teaching CPD training, I'm teaching courses to chiropractors and other health professionals outside the remit of cupping and hijama already. And Dr. Nuruddin Hassan, who also is involved in our training program and teaching for us, he teaches at an academic level. He teaches at Cardiff University. He teaches undergraduate medical students and dental students, and he teaches them in areas of physiology, pathology, and these are some of the subjects which he is also delivering on our course and in our training. And we've also got Dr. Mike Grice, who delivers the anatomy aspect of our training, and he also has delivered training, or teaches the same courses on a professional level to other students in the College University of Birmingham. So there's lots of people who, lots of practitioners who are learning from us from the levels, a completely different level. So if you look at it from the perspective of the quality of the education, first of all, I think there's a difference. I generally have a approach when it comes to learning anything, is that you need to be very cautious of where your sources of knowledge are from and who your teachers are. And if someone is teaching something, they need to be qualified to teach in that subject. Now, I know there's a number of different providers who offer training in hijama, from one-day workshops to internet courses where you have, receive a number of emails and things over a period of time. And there's a variety of different kind of levels. So simply doing a Google search and finding out who's offering hijama training and where you can get certification, at the cheapest price is not really a good way of doing a comparison, because you don't really understand, the quality of what it is that you're receiving. On top of that, our training as well, I would say, is very different in the way that the objective of our training is not just to kind of watch you do hijama on someone and them do hijama on you, and then we give you all certificates at the end of it. That's not the approach that we have. What we're designed, the reason we've designed this course is to help create professionals and practitioners who are capable of helping people in their health, which means that our course is not a hijama course, or not just a hijama course. Our course is, as it says it is, it's a practitioner certification program, and it's designed to help you become a practitioner who will be able to help people in their health and help them improve their health. In order to do that and take people's health into your own hands and have that responsibility, you need to have some form of understanding of how their body works, and understanding of not just how their body works, but also how problems can occur in order to be able to correct those things. So in a nutshell, what we deliver is at a very high quality and high standard, and the level of education that you'll be receiving with us is a completely different kind of level than what you'll be receiving from the majority of the providers. As I said, the reason behind this is the quality of the teachers, the quality of the education and the knowledge that you learn. I've seen the content of some of the other courses out there, and a lot of it is just literally kind of copy and paste material that you can see and you can find anywhere on the internet. And it's not really kind of bespoke to the concept and the study of hijama and understanding the clinical sciences. In our program, you learn anatomy to a great deal of depth. You see that there's people out there who are saying that they're offering hijama training at level 5 and level 4 diplomas. What I would say is just our anatomy module alone is a level 5 qualification. So if you think of it in that context and you think of it in that perspective, you'll see that the comprehensive nature of the training is what makes us different from the rest. So that's a very big difference I would put there. The other thing which makes our training very different is the actual structure of the training itself. As I said, we study anatomy, physiology, you study the human body, you study how it works, you study pathology, you study where things go wrong, you study the clinical sciences, so some of the stuff that you would have had to cover in A-level, biology and chemistry is covered in our training program, as well as obviously the science behind hijama, the physiological interactions, what's physically happening to the cells and the tissue underneath. We look at the scientific research behind that and we put this all together. Now, we teach you clinical skills, the skills that you're required to learn when you're dealing and interacting with patients, because this is a science in itself, and it's an art, and it's something that you really need to understand in terms of what we call behavioral sciences or patient's behavior, and how that influences and influenced by what you do. So this is kind of quite comprehensive and it's holistic in that way. The structure of the program, as I mentioned, is we used to deliver all of our training on a one-to-one basis. So we used to have classes where our students would come in and they would sit in the classes and they'd sit in the workshops, and we would teach all of this stuff over a period of time. The courses have spanned between 6 and 9 months, where people have had to travel. They've had the travel expenses, accommodation, and obviously the time. A lot of the people who study with us, including doctors and professionals, have had to take off time from work and things to study these courses and study our course with us. Fortunately, we've managed to refine the course in the way that we've recorded all of those live sessions, and we've now got them available for you to access online in the comfort of your own home. So a big difference, again, with what we're offering is in terms of the content that you study with us. There's over 100 hours of video lectures that you're going to be studying, and the material and the supplementary stuff that goes along with it. Again, this is very different from paying £500 or £800 or £900 for a series of emails which you'll receive, which have downloadable PDFs, which is just content which you have to just look through and read. Again, a lot of it, at a very low level. They say, okay, this is the heart, this is the lungs, this is the stomach, this is the spleen. This is the level of anatomy that is often covered in these courses. With the training that we offer, you will literally know every single name of every single bone in the body, of the joints, of how they work, of the muscles, of the tendons. You'll learn all of this knowledge and material to the level and to the extent where we've had doctors that have studied with us, we've had physios that have studied with us, and even they have said that, the level that they're learning here is at such a high level that they've learned new things. And have a look at some of our testimonials, to second what I'm saying there. The third and final thing which I'll cover in terms of what makes us different is the practical elements of what we do. With a lot of the courses, the majority of the courses out there, if they're not one-day workshops or two-day workshops at the best, then they are online courses which you have to attend a one-day workshop, or I've even seen online they have a Skype assessment. So they're going to teach you over Skype how to practice a practical thing. It's like having a Skype teacher to teach you how to drive. It's a very practical thing. It's a very involved element. And, in such a short space of time, we don't really believe that people can be competent, through just that medium. So what we have as part of our training is that we have, not only do we have workshops scattered throughout the duration where you can attend optionally, but you also have a clinical internship, which means that once you've completed stage 1 and stage 2 of the theory content, once you're up to date with all the theory knowledge, you then move on to your internship, which means that you physically come here, you work in our clinic. This is part of, I'm in one of the consultation rooms here at the moment, and we have a 3-story building which is dedicated to what we do. So again, we're not a online business which runs from the bedroom of someone, or kind of a home run business, an online entrepreneur type thing. We run a serious organization here, or a clinic, or an institute which is involved full time in doing what we do, and our staff here are dedicated to making sure that our practitioners come out the other end competent and confident in what they do. And the way that we achieve that is through the final stage of the training, which is our clinical internship. So when you train with us, where your level of experience is not limited to workshops where you practice on each other. What you actually do is you come in here and you work with us, and you work on real patients. Okay, so we mentor you, you assist us to begin with. We work one-to-one. Okay, so this is flexi learning as well. So it's not a fixed date that you have to come in from this time and that time, and we have a big batch of people which we're trying to all educate. No, the way it works is once you've complete the theory content, once you've met the satisfactory levels of required levels, you then join us in clinic. And what we do is we work with you directly, one-to-one. You mentor, you're mentored through it. You assist us, first of all, you watch what we're doing, and then you start taking over as well, hands-on. And this is how it's always worked. From the time of Galen, from the time of Ibn Sina, from the way I studied in chiropractic school, the way osteopaths learn, this is the way it's done in healthcare. It's the standard protocol. That you work along with people who experience and know what they're doing, you gain from their knowledge and experience, and then you build on that for your own level of knowledge and confidence. So this is the way that we teach our students, and this is the way that ICAHT practitioners are trained. They work with them for a minimum of 50 hours. So you can do this on flexi time. You can come in and do an hour one day, 4 hours one day. You can just do a whole week back to back. But as long as you complete that time, what you gain from this is massive, because you are gaining not just the experience of seeing other practitioners and how they work, you're also getting the experience and the exposure to a wide range of patients. We see on average between 20 to 40 patients a day. So spending one day with us, you get a wide variety of exposure to various patients, all with different conditions, different problems, complex needs, and you are then challenged and you're pushed then under supervision with that comfort that you're already around people that can help you and to make sure that you're doing things right. And you have that ability then to learn through that experience. And as any health practitioner knows, you learn from your patients. And when you have a good number of patients below your belt, in the sense that you've experienced and you've had that exposure, your level of competence increases, your level of confidence increases, and when you see another patient who has a similar condition that you've seen before, you're able to then kind of address that case with confidence, rather than doing what a lot of people do, which is guesswork. Okay, when people do a one-day workshop, or they do an online Hijama Nation course, or whatever you want to call it, all these different providers that are out there, often they're left in a position where they have to go off and do case studies, and they have to do whatever they do. And when they're deciding on how to manage that patient, it's guesswork. It's completely guesswork. They're not necessarily taught, okay, this is how you deal with these circumstances. And you can't teach that over the internet. You can't teach that through a PDF document. You can't teach that over Skype, because each patient has their own individual needs. They have their own individual requirements, and each case has to be assessed on its own merit. So you cannot say to someone, okay, well, this is how you work, because if that was the case, then medicine would just be a book that we follow and we say, okay, this is how you apply it. Obviously, you need that practical application. You need to consider lots of different factors. You need to take all of this into account, and we provide that to our students when we train them, and when you're studying at our institute. You get that ability to integrate all the study and the knowledge that you've had, and we assess you in that way as well. So we don't ever pass a practitioner unless we're happy with their level of competence. And like I said, we have 50 hours of one-to-one work. I work personally with the students, and we have different practitioners here who also do that with us. So you have that level of confidence and competence that you build through that. The final thing that I always get asked, and this is the one which is often a sticking point, is people say, why is it that your price is much higher than other providers, or it's more expensive? So first of all, what I would say is actually we're not higher priced. We're actually much lower priced than all of the other providers, if you really consider it properly. So first of all, if you consider the 50 hours of 50 hours that you're involved with your clinical internship, on top of that, you've got over 100 hours of the videos. So you've got 150 hours there to start with. Okay, so 150 hours divided by the fees that we charge. Okay, so if we let's say, for example, we charge £2,000, and if you divide that by 150 hours, versus you're paying £400 or £500 for a one-day workshop, which is 10 hours. Okay, it's less than 10 hours. So if we just say on average you're paying £50 an hour for that training. Okay, £50 an hour, and what are you actually getting from it? You're not necessarily getting the end result, which is to become competent and be able to help people in their health in the way that you should. So in terms of costings, first of all, what I would say is that what we offer is very different in the quality. So the quality of what we're providing, I believe, is much of a much higher level from the knowledge I have of the training that's out there and what I've experienced. The second thing is that the quantity with what you're getting with us is a lot more. Okay, so you receive a lot more knowledge, you receive a lot more information, and it's more applicable as well. So in terms of costings, definitely I believe that we're much lower priced when we look at it from the actual evaluation of what we're doing and what other people are providing. And believe me, we've had so many people who, to be honest, the majority of students we have done other courses first. So they've come and they've gone and they've done an online program, they've done examination training, they've done the health means wealth workshops and things. And to be honest, a lot of these can be great for some people, and they're good introductory courses if you want to just kind of practice on friends and family, or if you want to operate at a certain level. But in my opinion, when you're doing this on a big scale and doing this kind of in a way where people are actually paying you for your time, they're paying you for your knowledge and expertise, you need to have some substance there. You can't be ripping people off and saying, I know what I'm doing, but you don't actually have the knowledge to go with it. So from that perspective, I think it's a duty upon us as practitioners to know our stuff and to go and pride ourselves in knowledge. Okay, and that's an important thing, is that it's our responsibility to have that knowledge when we're taking people's health on. And the other thing I was just going to mention is that in terms of even with the costings as well, if you compare to what we're offering and you compare it to real courses, which are taught by professionals, which are taught by, which are, let's say, in the alternative spheres, for example, if you look at acupuncture courses, courses in hydrotherapy, courses in naturopathy, courses in nutrition, if you look at this in comparison, the cost is so low. Our entry point is very low. What we're charging is much less than what these other professional courses are charging. But on that same note, you're actually taking away a lot more, because you have input from so many different sources, from osteopathy, you have input from chiropractic, you have input from naturopathy, you have input from academia, medical doctors. We've got a good variety and a good distribution of people who are involved in delivering this course. So our students take away a lot more than just understandings in hijama therapy and how to practice hijama. They take away knowledge and experience in the field of what we call integrative medicine, working with patients to better their health and understand it from a holistic perspective, while understanding the scientific basis behind what we're doing and understanding exactly what we're doing with our patients and how it's influencing them. So I know that was a little bit long, but on average myself and the staff here, when we get calls from people who are interested in our training, we usually spend an hour, 45 minutes to an hour talking to them and explaining all of these things. So I thought I would address those two questions, which are really the most common questions that we get and the ones that usually take a lot of time to understand. But really, it's common sense. You get what you pay for in the sense of your education, and if you're gonna go for the option of going for the cheapest course, then you're going to be shortchanging yourself and shortchanging your patients in the long run. Not every student who approaches us is taken onto our program. I make it very clear that if you're coming on our course because you feel like you already know what you're doing and you don't need to learn anything, you just want that certification, you just want that piece of paper to say that you're qualified so you can get insured and get recognition, then this isn't really the course for you, and we don't sell certificates. What we are providing here is a service where we help you educate yourself, and we open your eyes to so many different things and so many different views when it comes to healthcare and managing patients. That's what it's about. You're paying for the education, you're not paying for a certificate. So I'd just like to kind of highlight that, and I'd just like to kind of reiterate on that point. That's what we're about. So if you have any more questions, then you can comment and we'll get back to you. You can also give us a call if you visit our website, which is ICAHT.co.uk, ICAHT.co.uk. You can get in touch with us and find out more about that. This is what I've just described is the pathway for new practitioners who are into this. We do have a pathway for CPD practitioners, as a CPD training for people who are already health professionals and they want to learn more about cupping and start applying cupping into their practice or hijama into their practice. We do have that option. If you want to find out more, get in touch with us. But I thought I'd give this short explanation so that we can hopefully direct people who have these questions to save us repeating ourselves over and over again, which we often find ourselves doing. But don't be shy, get in touch with us. If you are interested in taking the decision to learn hijama and practice hijama and start offering this on a professional level, then get in touch with us. We'll be happy to give you as much information as you want. And just as general advice, don't rush into choosing a hijama place to study with or hijama education provider. Do your research, really understand the market, go and speak to practitioners who have studied and qualified, go and look at the way they're practicing. We're proud of the people who have studied through us. They've set up clinics, they're treating big names. We've got, as you can probably see from our Facebook page, our practitioners are treating Anthony Joshua, they're treating big footballers. So this helps you understand that they're not just limited to the Muslim community, and then when they're taken out of their comfort zone, they become shy and they don't know how to explain what they're doing and what they're all about. You should have the confidence to explain this, whether it be on BBC, as you've probably seen in our interviews, whether it be on live TV, in a stand-up kind of event where you have to stand up and address a crowd. You should be able to have the confidence and competence to speak about this in the right way. This is the sunnah of the Prophet ﷺ. It should be elevated to that level, into that standard. So I'll finish up there. Again, any questions, give us a call. You can call us. You can find our numbers on our website. Otherwise, 0800 955 3575. You can contact us directly and you can get through to myself or one of the other staff members, and we'll answer any questions that you have. Jazakallah khair for listening, and hope to hear from you soon. Assalamu alaikum.